Joining us now, Elaine Parker. Always great to have Elaine on before Christmas because Elaine is I'm going to call her the godmother of the new health care plan, healthcareforyou.com. Got to go to healthcareforyou.com. This is a plan that Elaine has worked on as the president of the Job Creators Network Foundation for a very long time. It's a grassroots, bottom-up plan. You know, we've carved this in depth. We've had doctors on. We've had them on taking your phone calls. And this is a plan that's now been adopted. Get this. Elaine's plan, this is pretty neat, Elaine. Her plan has been adopted by the White House. It is now part of their policy. The president is going to be campaigning on this health care plan, bottom-up. Go to healthcareforyou.com, healthcareforyou.com. I'm running for national delegate again for the Republican Party in my district here in Virginia for the Charlotte Convention. When I do win that race, with your help, obviously, my listeners, then I'm going to ask to get on the Rules Committee, which goes a week early, and I'm going to try to get this in the platform. And I think I'm going to be able to do it because I've already talked to a lot of people on it. But this healthcareforyou.com gaining tremendous momentum around the country at the grassroots level. And joining us now to kind of flush this out, how we get to the next step as we go into 2020, Elaine Parker. Elaine, the president of Job Creators Network Foundation. Elaine, great to have you with us.
Good morning, John.
I know you've been fighting for this hard. You've gotten the White House's attention. The president is actually going to take your plan, and it's going to be in his campaign platform. I mean, how cool is that, Elaine?
Yeah, we're really excited. It's been very well received. Former Speaker Newt Gingrich has endorsed the plan. Former HHS Secretary Tom Price has endorsed the plan. It's got a lot of overlap and similarities of our elements to the Republican Studies Committee. So there's a lot of consensus on the direction that we need to go, and that's personalized health care. That's what our market research showed that the American people wanted. And they don't want a top-down approach. They don't want a one-size-fits-all. They want to keep their doctor. They want the doctor-patient relationship restored, and they want to get bureaucrats out of making healthcare decisions for them. And the way we do that is to prioritize reform from the bottom up rather than the top down, which is exactly what happened with Obamacare. Mm-hmm. And John, in practice, this means deregulating the insurance markets and allowing states to set insurance parameters while maintaining protections for those who have pre-existing conditions. Let me repeat that because it consistently gets said differently by Democrats. We want to maintain protections for those with pre-existing conditions. And again, we want to have personalized health care instead of a one-size-fits-all that would unleash a flood of new insurance options for people who want a Cadillac plan to just a catastrophic plan. But patients, consumers would be able to tailor what they need to their specific needs.
So I want you to get back to pre-existing conditions because this is where your plan has been criticized on, that you guys are kind of leaving it open, like, well, it's going to be up to the states, it's going to be this or that. But let's get in the weeds here. So if your plan became law, and I've got a daughter who has asthma, all right, chronic asthma, and she's 29 years old, right? So she has a pre-existing condition, and she's under your plan. Actually became law, all right? So she changes jobs. She tries to get new insurance, and under the old system, she could either get before Obamacare, insurance companies could just reject her, or she'd have to pay an enormously high rate. Walk us specifically in that specific instance, how would my daughter Claire, how would she be dealt with?
Well, I just want to correct you on one thing, because it's not that just before Obamacare that insurance companies could reject you. It was actually, many states already had protections in place at the state level that insurance companies could not reject you and could not cancel your policy. And that is an absolute requirement of having healthcare for you. Our plan includes protecting those pre-existing conditions. But the idea of of deregulating the state insurance markets and allowing different levels of plans to be offered within the states, creating a vibrant market where insurance companies are competing for consumer dollars, will bring the cost of all the plans down so that everybody can afford them. And then to allow states to set up, what they see best for their constituents, because what works in Kansas is not going to work in New Jersey. And so what states can do, what they can opt to do, is set up guaranteed risk pools for people who have pre-existing conditions. But one of the ways that goes a long way to helping people not have to deal with pre-existing conditions is if we expand HSAs, and that's health savings accounts, so that consumers and patients own their own insurance policy, and allow employers, which is where most of us get our insurance from. It's employer-owned insurance. 85% of us get our insurance from our jobs. And so when we leave one job and we go to another job, we have that lapse in coverage. Well, if we own our own policy, just like our car insurance, just like our life insurance, and we move from job to job, we never have a lapse in coverage. And therefore, you never have a pre-existing condition. That goes a long way for a lot of people. Now, there's still going to be a group of people who, chronically ill, who are going to fall into that pre-existing condition category. And that's the point of setting up guaranteed risk pools for that group.
Well, how do you set those up?
It's a state-by-state, the states set them up themselves.
Right, so therein lies what you just said, Elaine, and I'm fleshing this out because we're going to have to defend this, right? Therein lies right there. That's the Democratic argument. That's you're hoping that states get some kind of a pool. You're hoping that state competition between states brings it down. But at the end of the day, right now, we have a federal law that says you cannot be rejected for a pre-existing condition. Your rates are not going to go up the way they did in the past. And they're going to be saying that, the healthcareforyou.com plan leaves it up to speculation. And so people don't want to give that up. And therein lies the trap door that we have, right? Because it's speculative. It's states have to do this, prices have to come down, a risk pool has to be set up. That's got to get funded because you can't make money on that. It's a money-losing proposition. So then you get the devil in the details, and then our position starts to become untenable as it relates to pre-existing conditions, which is going to be the battle in 2020 for this plan, in my judgment. So how do we defend this?
Well, so it's not speculative, John, because it is a true economic fact that as you inject competition and price transparency into any industry, price comes down, innovation gets better. Mm-hmm. And healthcare is no exception to that fact. Mm-hmm. So as you let states, there are various different models that states can opt to set up a model for protecting pre-existing conditions. Many of the states already have laws at the state level that do that. Other states can amend their laws and change and make them stronger if they need to. The reality is the American people want pre-existing conditions protected, and that's something that's very important. And there's a lot of different models to do that. But when you look at the competition, bringing the overall cost of health insurance down, mm-hmm. It actually will free, if you think about it, it'll actually free up resources that are currently going to people as subsidies to afford the extreme cost of Obamacare. Mm-hmm. And those subsidies can be redirected for resources like protecting pre-existing conditions and setting up these guaranteed risk pools. So you've got to look at the full spectrum of how personalized healthcare can work at bringing down the cost of healthcare for everyone.
So you bring down the cost, and so the subsidies that are going to be part of this program then get redirected to covering those in risk pools with pre-existing conditions. See, that people can understand that, right? So that makes sense. But the key to your plan, and you can get all the details. Go to healthcareforyou.gov. The key to your plan is it opens up competition. It gets out all the bureaucracy and the middleman. it drives prices down. We've had doctors on the show who are telling us exactly, the details of how this works. And we had one doctor that I think her son played football, had to get an MRI, and she shopped it. And one place wanted $600. She got it for $110, 2 towns away. So obviously there's a big cost difference. It comes down, but and then we can take that savings. There's going to be some subsidies and redirect that to pre-existing conditions in that risk pool that you talked about, right?
Yeah, absolutely. And you're talking about direct primary care when you're talking about bringing costs down like that. And what we'd like to see is, as we expand health savings accounts, allow people to use those dollars to pay for direct primary care. And that is basically direct care to a patient, where patients are offered primary care from their doctor. There's no middleman. There's no insurance company. It's one low monthly membership fee, kind of like a gym membership. But patients can get access to their doctor at any time through calling, texting, telemedicine, obviously in person. But prices are posted at surgical centers and imaging centers. And the interesting thing is, these cash prices for imaging, like you said, an MRI, are as much as 40% lower than the insurer's negotiated rates. 40%. That is substantial.
Look, we have got to get this done. And, part of it is just education and getting it out there. And a lot of people, Elaine, as you know, got burned over repeal and replace because there was no replace, right? And that was really the genesis, Elaine Parker, for the Job Creators Network Foundation in driving this process to find an alternative from the bottom up, right?
Absolutely. And what we want to do is repair and restore. So let's get repeal and replace out of the conversation.
I like that.
We want to repair and restore the healthcare system for the American people so that it's affordable, people can rely on it, and there's choice and competition, and we can get that patient-doctor relationship back.
When did you guys come up with that, repair and restore?
This was all throughout our market research study. I mean, our market research study included 25,000 American voters, Republicans, Democrats, and Independents. And they came back and told us that they want personalized health care. They don't want a one-size-fits-all. They want to be able to keep their doctor. They want to keep their private insurance. And they do want choice, and they want affordability, and they want security. All of those things are very important to the American people. They don't want Medicare for all or government-run health care. And frankly, they want to pay for what they need, and they want to save the rest for later, another time. Excuse me.
Healthcareforyou.com, repair and replace. I love that. Repair and replace. Not, what was it? What was it that they were? Repeal.
Repair and restore. Repair and restore.
Repair and restore, not repeal and replace. There was no replace. That was the whole argument why so many people were upset, because they felt they got misled. So healthcareforyou.com, repair and restore. Okay, I got that. And so at the Democratic debate last night, you remember the first couple debates, like, health Medicaid for all is all the rage, and then Elizabeth Warren had to come out with her plan, and it was like $50 billion or $1 trillion, whatever it was. I mean, the numbers were ridiculous. And they didn't even talk about it last night. I think Bernie Sanders mentioned it one time. It was not even a topic. And because Warren actually put a number to it, she's dropped in the polls, and nobody will touch it. So I think that ship has sailed. I mean, the debate last night was really ridiculous. It's like these people live in an alternative universe. But look, Bernie Sanders, I think, is going to be the nominee. And one of the cornerstones of his platform is Medicare for all, right?
Yeah, I mean, and it's interesting to listen to them. They are talking in an alternate universe, because when you hear them talk about the economy is not doing well for middle-class Americans, I'm not sure what planet they're on, because here on planet Earth in the United States of America, the economy is doing fantastic, with the lowest unemployment rate we've seen in 50 years. Every demographic is got the lowest unemployment we've seen in decades. And there's more jobs available than people to fill them, which is driving wages up at a faster rate than we've seen in a decade. So for them to stand on stage last night and say that middle-class Americans are not doing well in this economy is just, politely, I say, disingenuous. But it's simply not true. And, when they talk about Obamacare, I mean, nobody wants the forcing the one-size-fits-all. Obamacare caused small businesses, more than 30% of small businesses, to drop health insurance for their employees because they simply couldn't afford rising premiums. And it never did anything to control the spiraling costs. And all it did was decrease choice. Those are the things that we want to tackle through Healthcare for You and our reform plan. So we're really excited about it. It's being really well received, as I said. And the American people, we just want to get the message out to the American people that there is an alternative. We'd love to see the Senate take up legislation next year so that the American people have a clear choice between a Medicare for all or Healthcare for You.
Healthcare for You, that's got to be the alternative to Medicare for all. Elaine Parker, great segment. Thank you for your clarification. I always love having you on so we can keep pushing the ball forward on healthcareforyou.com. Thank you so much, Elaine. You have a very Merry Christmas with your family, your daughters. Tell everybody I said hi in sunny Florida, and we will talk to you next week after the holidays, Elaine. Thank you so much.